Yes, Bu Ana.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Distinguished speakers and guests, Dr. Amelia Ratu, Chief Nursing Officer at the WHO Headquarters Geneva, Dr. Midori Anami Akimoto, WHO WPRO, Ms. Deki, WHO Indonesia, Dr. Catherine Sioncho, Assistant Professor at the University of Philippines, Prof. Nur Salam, Chair of Indonesian College of Nursing, Dr. Gita Nirmala, Chair of Indonesian College of Midwifery, Prof. Ferry Effendi, Prof. Kelana, Ms. Hetty Astri, and also all distinguished guests, colleagues, and ladies and gentlemen. On behalf of the Ministry of Health of the Republic of Indonesia and the WHO Collaborating Center, Poltekkes Kemenkes, I would like to warmly welcome all participants and all speakers joining us today from WHO headquarters, WHO WPRO, WHO Indonesia, the WHO CC of the University of the Philippines, and our distinguished facilitators. Your presence reflects our shared commitment to strengthening nursing and midwifery for better health outcomes. This webinar is our way to commemorate Midwifery Day on May 5th and Nursing Day on May 12, 2026, and it's a reflection to support the people who form the backbone of our healthcare system. Ladies and gentlemen, this year's theme of WHO CC webinar, Building a Future-Ready Midwife and Nurse to Address Global Health Workforce Challenges, is highly relevant to the realities we face today. Across countries, health systems are experiencing growing demands driven by demographic changes, evolving disease patterns, health emergencies, and workforce shortages. These challenges require nurses and midwives who are not only clinically competent, but also adaptive, collaborative, and prepared to lead change. Nurses and midwives represent the largest proportion of the health workforce and play a critical role in ensuring access to quality healthcare. Investing in their education, leadership, and professional development is therefore essential for building resilient health systems and achieving universal health coverage. Ladies and gentlemen, today's webinar provides us an excellent opportunity to learn from global perspectives shared by WHO colleagues, to reflect and on experiences from WHO Collaborating Center, or opportunities for research and international collaboration in nursing and midwifery development. The program has been designed to bring together policymakers, educators, professional organizations, researchers, and practitioners to exchange knowledge and strengthen partnership across countries. I hope today's discussion will generate practical ideas and inspire further collaboration to strengthen nursing and midwifery workforce development in our region and beyond. I wish you all a productive and enriching webinar. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh. Good day, everyone.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Bu Ana. So, moving forward, let us hear the welcoming remarks from the Chair of Indonesian College of Nursing. To Professor Nur Salam, the floor is yours, Prof. Sorry, Prof. The voice is not audible.
Waktunya dan kesempatannya ya. Mohon izin untuk mahasiswa kami kebetulan ada program magang atau internship di unit lansia di Jepang.
Still not audible, Prof.
Mahasiswa sudah berangkat dan kami itu masih belum paham mengenai nanti terkait konversi dari kurikulumnya.
Is it okay?
Yes, now it's okay. Thank you, Prof.
Okay, Vida?
Yes, Prof.
Okay, sorry. Okay, the challenging, global challenging for nurses, especially that the needs, especially for in health, demographic transition, and also the chronic disease and the technology. We need the nurse who has competency. In other countries, I think that the escape between the needs and demands about the nurses. So I think this is we need to have a good innovation, transformation in education, and also some of the increasing the competency. So I have the this is the patterns of Indonesian nursing in the future. I think when some of the Poltekkes are graduated from before, and then we have Sarjana Perawatan, and then from the nurses. So before they go to specialization, I think they can also have the competency, and we call advanced clinical practice. So after the graduate, and then they can take course for 6 months. Like in medical doctor, we have what's that? Yeah, for the course in this well. And this is also can be start from the beginning when they are studying in college. Like this is the example as also Bu Ana as a initiator to have a good in for the graduate nurses in Poltekkes Yogyakarta. We have some specific competency on orthopedic. So we can also all the nurses especially in Poltekkes can start from here, and then they also will be recognized to in BPJS and also the career. And of course, they have a good and competency. They have a certification, and when they are going to study on specialization, like we are going to recognize on this one. This is the program that we organize, and it's already put it and also put Anna known about this one. And this is the advanced clinical training process. So this one, I think, when nurse graduate from nurse, I mean they have STR1, jadi STR yang pertama, and then it is possible to have the STR2, STR yang kedua, we call STRKT, standar surat tanda registrasi kompetensi tambahan. So this is the candidate, and also this is from the first graduate, and then the right one is from the nurse who competent for this one. Okay, this one I think that's the global. And what's the competency on the right side? We have orthopedic, we have critical care, perioperative, and also emergency, kidney dialysis, as well as also in cardiovascular. So I think that's challenging for the future. So what's the important for to build the future ready, especially? This is one of the questions I think I have already mentioned. We prepare our nurses in Indonesia, and we can go also from this one. We can show that we need to prepare the future nurses. It's not only this competency, but also we have the critical thinking, leadership, communication, collaborative, and the others. So in the future, they can adaptable. I always say those who can survive in the future, those who have AIR, jadi air. A mean adaptation, E is innovation, initiation, and also R is resilience. So this is the important. And the last one, I think that we need the collaboration in the zona. Like today, It's great initiation for international webinar. So we can have a good relationship as a Minister of Health, have a good collaboration in all of them, especially in overseas. So the nurse can work in the international, like especially in education, also in the partnership, research, mobility, the lecture and the others. So the collaboration is not only in the academic approach, but also to to link the connection, yeah, professional connection to support the nursing in global network. So I think this is all my presentation, experience from nurses. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much for Prof. Nur Salam for the remarks. Now moving forward, let us hear the welcoming remarks from the Chair of Indonesian College of Midwifery, to Dr. Gita Nirmalasari. The floor is yours. And please, Dr. Gita, we would really appreciate if it can be like 2 or 3 minutes. Thank you.
Okay, thank you so much. So my voice is clear?
Yes, Bu Gita.
Okay, thank you so much. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. Thank you so much for having me to give the opening remark. The Honorable Dr. Anna Kurniati, Director for Household First Provision, Ministry of Health of the Republic of Indonesia, and the Director of the WHO Collaborative Center, and the Honorable Professor Nur Salam, Chair of the Indonesian Nursing Collegium, distinguished representative from the WHO headquarters, WHO Regional Office for the Western Pacific and WHO Indonesia, esteemed speakers, representative of the WHO Collaborating Centers teams, colleges from nursing and midwife, and academic institution, professional organization, and all of the participants joining us today. It is a great honor for me, on the behalf of the Indonesian College of Midwife, to join this webinar commemorating International Midwife Day and the International Nurses Day in 2026. Today, I will especially like to recognize and celebrate the remarkable contribution of the midwife across Indonesia and around the world. Midwives are the trusted health professionals who provide essential care throughout the reproductive life course, from adolescence, preconception, pregnancy, childbirth, and postnatal period, to the family planning and sexual and reproductive health services. And we know that for decades, midwife has been at the forefront of the effort to improve the maternal and newborn health. And our contribution has been instrumental in reducing maternal and newborn mortality, expanding access to the quality care, and promoting to the health and well-being of women, families, and the communities. So we know that in many settings, particularly in the rural and the underserved areas, midwife remain the closest and the most accessible health professional for women and newborn. And we reflect on this year, the theme of this webinar, Building a Future Ready Midwife and Nurse to Address Global Health Workforce Challenge. So we are reminded that the future of the health system depends on a strong, competent, and supported workforce. For the midwifery profession, in this mean we investing in the quality. We need to invest in the quality of education, competency-based training, professional regulation, leadership development, research capacity, and continuing professional development. For future ready midwife must be prepared not only to provide the evidence-based clinical care, but also to respond to the emerging challenges, including the technological transformation, changing population needs, health emergencies, and growing expectation for respectful and woman-centered care as our model of the practice. And midwife must be empowered to lead, innovate, advocate, and collaborate across discipline while remaining firmly committed to the right dignity and well-being of women and newborn. So in Indonesia, we continue to strengthen the midwifery education and professional standard in alignment with the global development and alignment with the International Confederation of Midwife Standard and Competencies. We already provide that. And we believe that investing in midwife is one of the most effective strategies for improving maternal and newborn health outcomes and advancing universal health coverage. And I would like to express my sincere appreciation to the Ministry of Health, to the WHO, and the W Collaborating Center Poltekkes Kemenkes for organizing this important event. I hope this today discussion will inspire meaningful collaboration and collective action to strengthen the health workforce and advance the midwifery profession for future generation. Happy International Day for Midwife Day and International Day for Nursing Day, even though maybe we already celebrate in the May in 2026. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam.
Thank you, Ibu Gita, from your remarks. So now, following the opening remarks, we will now proceed to the main session for today's webinar. And today's discussion is organized into 3 interconnected topics. The first topic will be the global perspective on the nursing and midwifery workforce, and the second will be WHO's Collaborating Center best practice sharing, and the third topic will be research innovation and international collaboration. So each speakers will have approximately 15 minutes for their presentation, and following all presentation, there will be a discussion and Q&A session. And participants are welcome to submit questions at any time through the Zoom chats or Q&A feature box. And please, while submitting your question, please include your name and institution and the name of the speakers to whom your question is addressed and your question. Well, the main session will be moderated by Ms. Zakia Eke, the National Professional Officer for the Health Workforce at the WHO Indonesia. So to Bu Eke, the floor is yours, Bu.
Thank you so much, Mbak Vida. Good afternoon, distinguished speaker, colleagues, and participants. Join us through Zoom and YouTube, and also it's really also in the Pelataran Sehat. My name is Zakia Eke, and it is a pleasure to moderate topic 1 of today's webinar. As we know, nurse and midwife are central to primary health care, quality services, health security, and universal health coverage. This first session will examine the global challenges, regional priorities, and country action needed to prepare a future-ready nursing and midwifery workforce. Let us begin with topic 1, global perspective on the nursing and midwifery workforce. Our first speaker for this is Dr. Amelia Latu Abduhamamo, Chief Nursing Officer at WHO Headquarters. Welcome, Dr. Amelia. Thank you together with us. Dr. Amelia will bring extensive research in nursing leadership, health policy, and health system strengthening, and previously served as Minister for Health and National Chief Nursing Officer of the Kingdom of Tonga. So, Dr. Amelia, the floor is yours. Thank you so much.
Salamat Tian. Bonjour and good afternoon. Distinguished guests, dear nurses, midwives, partners, colleagues, dear Dr. Anna Kurniati, Dr. Midori Akimoto, Miss Eke, warm greetings from the WHO headquarters in Geneva. It is a joy and a privilege to be with you today. Today we gather not only to commemorate the International Day of the Midwife and the International Day of Nurses, but to honor the courage and commitment and compassion that nurses and midwives bring to the world every single day. Let me begin by congratulating the WHO Collaborating Centers at Poltekkes Kemenkes, Madam Director, and your exceptional team. Your leadership and partnership with WHO are shaping the future of health in Indonesia and beyond. If we truly want resilient, equitable, people-centered health systems, then we must invest boldly and intentionally in nursing and midwifery and future-ready leadership. I salute you as experts in Indonesia, and we hear it very well from the colleges of nurses and midwifery that has just delivered a presentation and speeches. And of course, you're the expert across the region, but please allow me to share. Nurses and midwives, as has been shared by Madam Director, are the backbone of health systems. They are the first to serve, last to lead, and often the only health professional many communities will ever meet. Their leadership potential is immense, shaped by deep understanding of the lived realities and experiences of people and communities. And yet, far too often, it remains untapped and underutilized. This is not a limitation. It is a powerful opportunity awaiting to be realized. An opportunity to build stronger teams, starting within ourselves, build stronger collaboration and partnerships, as we have heard, an opportunity to transform health systems, an opportunity to deliver hope, dignity, and trust to every community. When I served as Chief Nursing Officer of the Kingdom of Tonga, we revised our Nurses Act and introduced the Nurses, Nurse Practitioners, and Midwives Act 2021. When the Legislative Assembly endorsed it unanimously, it was a moment of pride to every nurse and midwife who believed that the legal recognition of nurse practitioners and midwives was possible. It's the ever first time this was recognized by law. It proved that we can achieve them when we unite and act with one voice. The Global Strategic Directions for Nursing and Midwifery 2021-2030 calls us to invest in leadership, education, opportunity to ensure more nurses and midwives in senior roles, to expand their authority, to prepare the next future-ready generation leaders, to lead with confidence and courage and compassion. Investment matters, investment transforms, and investment saves lives. Invest in quality education, advanced practice roles, continuous learning, mentorship, diplomacy, and cross-cultural understanding, investment in decent jobs and safe working conditions, because nurses, midwives, and health workers who are protected can protect others. This is also an opportunity to strengthen integrated approaches across the health workforce with other healthcare professionals, across health system building blocks, and across government sectors. The health workforce is one of the 6 foundational components and pillars of a health system. Embracing system thinking and intentional collaboration with executive leadership, financing, health information systems, medical products, and service delivery are essential to ensuring community trust, sustainability, and advancing long-term health goals. At the WHO Academy, where I lead advocacy, partnerships, and also resource mobilization, we are committed to walking this journey with you. With more than 400 free online courses in 24 languages, we are building a global learning community where every nurse, midwife, and health worker, from the most remote village and islands to the busiest city, can grow, lead, and thrive. And we are just getting started. Our nursing and midwifery program will further strengthen the skills and confidence and competencies of the health workforce that hold the world's health in its hands. My colleagues, dear friends, the future of health system will be written by the people in this webinar, by nurses, by midwives, by leaders who believe in equity, dignity, and universal health coverage. Together, we can build health systems that are resilient. Together, we can advance universal health coverage. Together, we can create a fairer, healthier world for Indonesia and the people everywhere. I wish you every success in your deliberations. Terima kasih banyak. Merci beaucoup, Malo Alpito, and thank you very much.
Thank you very much, Dr. Amelia, for your inspiring session that set the global context clearly. You have also highlighted the need to prepare nurses through competency-based education and also expanded practice roles, leadership, employment, and stronger country investment. So thank you so much, Dr. Amelia. After the first session, we can take photo together, I think, and then Dr. Amelia can leave the session. So we will go to the next speakers. Our next speaker is Dr. Midori Anami Akimoto, nursing officers from WPRO. Dr. Midori support member state in strengthening nursing and midwifery policy, education, leadership, workforce capacity, and primary healthcare across a highly diverse region. So because currently also we have a general meeting on WHO CC Nursing and Midwifery at Mahidol University, and Dr. Midori is fly back to Manila. So Dr. Midori sends the video record to us. So thank you so much, and please play the video. Thank you.
Good afternoon, everyone. My name is Midori Anami Akimoto, nursing officer at the WHO Regional Office for the Western Pacific. First of all, I would like to warmly congratulate Poltekkes Kemenkes WHO Collaborating Center on organizing this important webinar. It is a great honor to join you today as we commemorate International Midwives Day and International Nursing Day, and to reflect together on nursing and midwifery education, international collaboration, and the role of WHO Collaborating Center. Let me share the slide. Today, I will briefly introduce the nursing and midwifery workforce in the Western Pacific region, and then discuss how WHO Collaborating Center can contribute to strengthening nursing and midwifery education, workforce development, research, and collaboration. Let me start with a brief introduction to the Western Pacific region. The Western Pacific region is home to 38 member states and areas, and more than 1/4 of the world populations. It is a highly diverse region. It includes countries with a very large population, as well as a small island state. Health system, population structures, geographical condition, and health workforce challenges vary widely across the region. At the same time, many countries are facing common challenges. This is why regional collaboration, knowledge exchange, and mutual learning are so important in the Western Pacific. In the Western Pacific region, There are around 9 million nurses. This represents approximately 30% of global nursing workforce. Nurses are also the largest group within the health workforce in the region, and they form the backbone of our health system. Nurses and midwives support people's health in many settings, not only in hospital, but also in communities, schools, homes, primary health care, mental health, and maternal and child health, infectious disease control, NCD prevention and management, and emergency and disaster response. Therefore, investing in nursing and midwifery is not only an investment in one profession, it is an investment in health system as a whole. At the same time, health systems are facing increasingly complex challenges. In the Western Pacific region, these include rapidly aging population, the growing burden of non-communicable diseases, persistent health inequities, and shortage of health workers. These challenges are particularly serious in rural, remote, and underserved areas where attracting and detaining health workers remains difficult. To respond to these challenges, it's not enough simply to increase the number of health workers. We also need to ensure the health workers can use their competency effectively, respond to local needs, and work in supportive environment. Nurses and midwives are key enabler of universal health coverage and primary health care. To support member states in addressing health workforce challenges, WPRO developed the regional framework to shape a health workforce for the future of the Western Pacific, and is supporting its implementation across countries. The framework proposed 5 strategic action areas to shape a future-ready health workforce through a primary health care approach. The first area is aligning in 8 human resource for health policies with primary health care-oriented health systems. For nursing, this includes developing national nursing strategies, investing in nursing, and expanding the scope of practice of nurses where appropriate. The second area is strengthening human resource for health stewardship in health systems. This includes strengthening governance and ensuring that nursing and midwives are involved in decision-making process. The third area is producing and maintaining quality of health human resource for health. For nursing and midwifery, this includes updating and upgrading curricula and strengthening quality assurance mechanism in education. The fourth area is steering the private sector for public good. This is also important, as many countries have mixed public and private education and service delivery system. The fifth area is managing distribution and productivity in the public sector. This includes creating decent work environment and ensuring fair pay so that nurses and midwives can be retained and supported, especially in rural and underserved areas. These strategic areas remind us that strengthening the nursing and midwifery workforce is not only about increasing number, it is also about the policies, governance, education qualities, working conditions, and better use of workforce. WHO Collaborating Center can support member states in translating these priorities into practices. So, what is a WHO Collaborating Center? A WHO Collaborating Center, or WHOCC, is an institution designated by the WHO Director General to form part of an international collaborative network. WHOCC's work with WHO at country, regional, and global levels. Their functions are broad. They include the collecting and dissemination of information, standardization of terminology and method, development of appropriate technologies, provision of reference services, participation in collaborative research with WHO, training including research training and coordination of multi-institutional activities. In nursing and midwifery, WHOCC can help connect WHO's policies, evidence, and technical guidance with country-level implementation. They also support education, research, policy development, and workforce capacity building. In the Western Pacific region, there are several WHO collaborating centers related to nursing and midwifery. Each center brings different areas of expertise. These include nursing policy making and leadership, nursing and midwifery workforce development, primary healthcare nursing, community health services, disaster risk management, and hospital and palliative care. This diversity is one of the strengths of WHOCC network in the region. By sharing their expertise and experience, these centers can support learning and collaboration across countries. Poltekkes Kemenkes is an important member of the regional network with its focus on nursing and midwifery development. So, how can WHOCC contribute to strengthening the nursing and midwifery workforce? There are broad areas. The first is supporting policy and practice. WHOCC can help disseminate WHOCC guidelines, frameworks, and evidence. They can also support the translation and dissemination of important reports, such as the State of War Nursing 2025 report. They can contribute to policy dialogue and workshops to strengthening workforce policy implementation and provide technical advice on curriculum review, education standards, and professional regulations. In this regard, I would like to sincerely acknowledge and thank colleagues in Indonesia for their active effort in disseminating the State War Nursing report and convening policy dialogues to support nursing workforce policy implementations. The second area is strengthening nursing and midwifery capacity and leadership. WHOCC can provide a capacity building program to strengthening nursing, midwifery, and clinical competency, including primary health care. They can also support leadership development programs, as well as early career professional development through webinar, mentoring, and training. The third area is supporting technical cooperation and knowledge sharing. WHOCC can contribute technical expertise to WHO webinars, consultation, and regional or global meetings. They can also convene webinars and knowledge sharing platform where countries and institutions can exchange practical expertise and experiences. This is important because many countries are facing similar challenges, and there is a great value in learning from one another. The fourth area is promoting research and innovation. WHOCC can contribute to collaborative research on nursing and midwifery workforce issues, generate evidence to inform policy and practice, and support international research collaboration and scientific exchange. The midwifery research program and the nursing clinical instructor training program, which will be shared later today, are excellent examples of how education, capacity building, technical cooperation, and practice can come together. Looking ahead, I also hope that these practical experience can be further linked with research and evidence generation so that Indonesia's experience can be shared more widely across the region. To conclude, developing a future-ready nursing and midwifery workforce cannot be achieved by one country or one institution alone. It requires international collaboration, knowledge sharing, technical cooperation, research, and leadership development. WHO Collaborating Center are an important network to support this work. I look forward to seeing Poltekkes Kemenkes, WHO Collaborating Center, continue to contribute not only to nursing midwifery development in Indonesia, but also to workforce development across the Western Pacific region and beyond. WPRO look forward to continuing our collaboration with you. Thank you very much. Terima kasih banyak.
Thank you so much, Dr. Midori, for this important regional perspective. Dr. Midori's presentation has emphasized that countries need to go beyond producing more graduates and focus on education quality, appropriate scope of practice, leadership, decent working condition, and the effective use of nurse and midwifery in primary health care. Dr. Midori also shown how WHO Collaborative Center bridge global strategies with local action through research, training, information exchange, and institutional capacity building. So for now, we go to our next speaker, Ibu Deki. Thank you, Ibu Deki. Ibu Deki is currently OIC team lead at Health System Strengthening Team at WHO Indonesia. She has extensive experience in health workforce planning, governance, education, regulation, and health system strengthening in Bhutan, Papua New Guinea, Fiji Island, Indonesia, and WPRO's country. Ibu Deki will present about strengthening nursing and midwifery for better health system. So after Ibu Deki presentation, we will take a photo together with the speaker from session 1. So Ibu Deki, thank you so much. The floor is yours.
Thank you, Eka. I hope I'm audible.
Yes.
Thank you, Eka. Selamat siang from Jakarta. Good morning, good afternoon, and good evening, distinguished fellow speakers, participants, colleagues, partners, ladies and gentlemen. Is somebody putting up a slide?
Yes.
Thank you. So meanwhile, let me introduce myself. As introduced by Eka, my name is Vicky. I'm the Technical Officer for Health Policy and Strategy, and currently the Acting Team Lead for Health Systems at the WHO Indonesia Country Office. First of all, I would like to join Dr. Amelia and Dr. Midori to congratulate Poltekkes Kemenkes, WHO Collaborating Center for Nursing and Midwifery Education and Development, for organizing this international webinar. It is indeed an honor to be one of the speakers at this international webinar held in commemoration of International Midwives Day and International Nurses Day. I will briefly share why strengthening nursing and midwifery is essential for stronger health systems and how global guidance, regional priorities, and Indonesia's initiatives are coming together to move this agenda forward. Next slide, please. Next slide, please. Thank you. So my presentation will cover 4 areas. First, why this topic matters. Second, global and regional direction. Third, Indonesia's progress in this agenda. And finally, the importance of partnership. Next slide, please. Nurses and midwives are the backbone of the health systems, which we have heard very strongly from Dr. Amelia as well as Dr. Midori, and then also the opening remark speakers. They deliver most essential health services, lead primary health care, and play a central role in prevention, health promotion, and community-based care. They are also key contributors to maternal and child health, disease management, and continuity of care. Beyond clinical roles, they are leaders, educators, and advocates. Ultimately, strengthening nursing and midwifery workforce is fundamental to achieving universal health coverage and resilient health systems. Next slide, please. Globally, the nursing workforce has grown, but major challenges remain. According to the State of the World Nursing Report 2025, the number of nurses increased from around 28 million in 2018 to almost 30 million in 2023. However, distribution remains unequal, with nearly 80% of nurses concentrated in countries representing only about half of the world's population. This imbalance means that millions of people still lack access to essential healthcare services. Next slide, please. This challenge is also visible across the Western Pacific region. If you look at this graph, there are significant differences in nursing workforce density with lower availability in many countries, including Indonesia. This highlights the need for stronger workforce planning and targeted policy interventions to improve distribution and access. Next slide, please. Thank you. So as we heard from Dr. Amelia, WHO developed the global strategic directions for nursing and midwifery to guide the countries. So this framework focuses on 4 core areas: education, jobs, leadership, and service delivery. The objective is to ensure that the nurses and midwives are well trained, effectively deployed, supported in their roles, and empowered to lead. It provides a practical pathway for translating global evidence into country-level action. Next slide, please. As we heard extensively from Dr. Midori's presentation, in the Western Pacific region, health workforce agenda, including nursing and midwifery development, is guided by the regional framework to shape a health workforce for the future of the Western Pacific, focusing on 5 strategic areas. Most importantly, it emphasizes aligning workforce strategies with primary health care and health system transformation agendas. Next slide, please. In Indonesia, strengthening nursing and midwifery is part of a broader health system transformation. Within these 6 pillars, covering primary care, referral systems, resilience, financing, workforce, and health technology, the health workforce pillar provides an important opportunity to strengthen education, planning, recognition, and competencies of nurses and midwives. Next slide, please. So in Indonesia, WHO supports the Ministry of Health through a systems approach to workforce strengthening. The goal is to ensure a workforce that is sufficient, well-distributed, and competent. This includes 3 main areas. First, strengthening data and analysis through tools such as health labor market analysis and national health workforce accounts. Indonesia is planning to convene a policy dialogue on the health labor market analysis in the coming months. Secondly, improving policies for deployment, retention, and distribution, particularly for primary healthcare. Third, strengthening education and learning systems through partnerships and professional development. Next slide, please. Thank you. Specifically for nursing and midwifery, WHO focuses on 3 priorities. First, supporting the use of evidence, including dissemination of the State of the World's Nursing Report to inform policy dialogue. Second, strengthening curriculum and in clinical education, including development of clinical instructor programs. Third, building capacity through training, mentorship, and leadership development. These efforts help translate global evidence into practical improvements in workforce performance and quality of care. Next slide, please. An important milestone in the designation of Poltekkes Kemenkes as a WHO collaborating center for nursing and midwifery education and development in Indonesia. The center focuses on midwifery leadership, clinical instructor development, research, and international collaboration. This reflects Indonesia's strong commitment and growing leadership in advancing the workforce nationally, regionally, and beyond. Next slide, please. Thank you. The previous one, please. Yes, thank you very much. Another important example is the national launch of the State of the World Nursing Report 2025. This was more than a report launch in Indonesia. It was a platform for policy dialogue, bringing together government, academia, professional organizations, and frontline workers. It also included the introduction of the nursing clinical instructor curriculum, which is an important step in strengthening clinical training and improving the quality of nursing graduates. Next slide, please. Thank you. Building a strong nursing and midwifery workforce requires collaboration. The Ministry of Health leads policy, planning, and regulation. Educational institutions contribute through training, research, and curriculum development. Partners support technical expertise, global evidence, and international collaboration. Within this space, WHO's role is to convene, connect, and support these efforts towards shared goals. In closing, strengthening nursing and midwifery is one of the most strategic investments we can make for resilient and equitable health systems. Indonesia has a strong foundation, clear priorities, and growing momentum through initiatives such as the WHO Collaborating Center. By connecting global evidence, regional cooperation, and national action, we can build a future-ready workforce that delivers better health outcomes for all. Thank you very much for your kind attention. Terima kasih. Thank you.
Terima kasih. Thank you so much, Ibu Deki, for your presentation. This presentation has brought the discussion into Indonesia health system context, and you have shown that nurse and midwife are the backbone of service delivery, especially in primary healthcare and underserved area. So thank you so much, Bu Deki. I think we will hand over to the second session that will be led by Mbak Vida. So, ladies and gentlemen, this concludes topic 1 on the global perspective on the nursing and midwifery workforce. So, I will hand over it to Mbak Vida. Thank you.
Thank you so much, Bu Eka. Before we move forward to the second session, let us have a group photo first. So please, everyone, I hope you can open your camera. And is it ready? Okay, so we will have how many slides? So please wait for a second. So we will have 3 slides, everyone. So now we will start for the first slide. 1, 2, 3. And then again, if we will start again for the second slide. 1, 2, 3. Okay, thank you. And then for the last slides, everyone. 1, 2, 3. Okay, thank you so much, everyone, and thank you so much, Dr. Amelia, Midori, and Bu Deki. Also, thank you so much, Bu Anna Kurniati, Prof. Nur Salam, and Dr. Gita. For Dr. Amelia, if you have any other matters, please, you can also, yeah. Join us later. And now we will move to the second session. For the second session, we will have a topic about the, yeah, Dr. Amelia, thank you so much. Yeah, thank you. Yeah. Okay, everyone. So now we will have a second session, and the second session will be about the WHO Collaborating Center Best Practice Sharing. And our first speaker will be Professor Kelana Kusuma Dharma, the head of the Nursing Division of the WHO Collaborating Center Poltekkes Kemenkes, as well as the Director of the Poltekkes Kemenkes Pontianak. Prof. Kelana has extensive experience in nursing education, institutional leadership, research, innovation, and international partnership development. And to Professor Kelana, the floor is yours. Thank you.
Okay, thank you, Bu Fida. Okay, can you hear my voice?
Yes, Prof, we can hear it clearly.
Okay, okay, thank you. Can you please help me to share the PowerPoint? Okay, thank you. Good afternoon, everyone. Distinguished colleges, distinguished Ibu Ana Kurniati, MA PhD, the Director of Health Workforce Provision, Ibu Eke from WHO Indonesia, Ibu Midori, WPRO, WHO, Chair of Nursing Collegium, Chair of Midwifery Collegium, representative from WHO Indonesia, academic institution, health professional organization, and all participants who attend this online webinar international. My name is Klana Kusuma Dharma from the WHO Collaborating Center for Nursing and Midwifery Development, Health Polytechnic, Ministry of Health Indonesia. Today, I would like to share you how we are implementing the Nursing Collaboration Initiative or NCI. Can you please share me the PowerPoint, please? Bu Fida?
Yes, sorry, Prof, there is a technical problem. Yeah.
Can you back to the first slide, please? Okay. Ladies and gentlemen, today I would like to share how we are implementing the Nursing Collaboration Initiative or NCI as a strategy approach to strengthen the nursing capacity and partnership development through education, collaboration, and sustainability. Okay, next slide, please. Ladies and gentlemen, why Nursing Collaboration Initiative important? As we know right now, around the world, health systems are facing increasingly complex challenges. The demand for competent nurses country to rise, and then healthcare service become more sophisticated and technology driven. At the same time, ensuring high quality clinical education remain a critical priority. We know that without strong clinical education, it is difficult to produce nurses who are competent and then adaptable and ready for future healthcare challenges. Another important challenges is strengthening patient safety cultures and expanding international collaboration in nursing education. And then recognizing this niche, our WHO Collaborating Center in Health Polytechnic, Ministry of Health Indonesia developed the Nursing Collaboration Initiative or NCI. So today we are going to discuss about this one, Nursing Collaboration Initiative. So the NCI serves as a strategic platform to strengthen the nursing competencies and then to standardize the clinical education, to promote international collaboration, and ultimately to contribute to resilient health system as well. Ladies and gentlemen, our key belief is simple, I think. Strong clinical education create a strong nursing workforce. We cannot develop the nursing workforce without strengthening the clinical education. This is our key belief. Next slide, please. Okay, this is the NCI framework at our collaboration center in Health Polytechnic, Ministry of Health Indonesia. So we have 5 strategic pillars. So the first pillar is nursing capacity development. And then the second is clinical education excellence. The third, leadership development. The fourth, research and innovation. And fifth, international partnership. So this is a very important pillars. I think today I would like to share you the first pillar, nursing capacity development. And then the fourth pillar regarding the research and innovation will be delivered by Prof. Ferry in the next session. Okay, this 5 pillar, I think interconnected each other and mutual reinforcing. So through this framework, we develop competent nurses and then we also improve patient care quality and strengthen health system. Rather than focusing on isolated training activities, I think NCI adopt a system approach in which education and then leadership, research, and partnership work together to create sustainable impacts. Okay, Bu Fida, next slide, please. Okay, this is the strengthening nursing capacity through NCI training. As I mentioned before, that we have 5 pillars. So the first pillar is strengthening the nursing capacity. In our collaborating center right now, the first time we developed the NCI curriculum training, nursing clinical instructor training curriculum. So why this is important, I will share you. One of the flagship implementation of NCI Nursing Collaboration Initiative is the International Standard Nursing Clinical Instructor Training Program. So this is our new program in our first year. Ladies and gentlemen, why did we prioritize these clinical instructors? Because clinical instructors are the bridge between the nursing's education and clinical practice. Without bridging this two important aspects, we cannot produce the quality competency of nurse in Indonesia and in global. So we need to bridging this nursing education and clinical practice. So the best curriculum will have limited impact if the clinical instructors are not adequately prepared. So we need to prepare our clinical instructor in the beginning. So therefore, why we develop the NCI or Nursing Clinical Instructor Training Program through collaboration among many components like WHO Collaborating Center, and then we also involve the nursing education expert in Indonesia. We also involve the clinical practitioner in hospital. We also doing the benchmarking reference, not only from the local from Indonesia, but also from the regional. So the objective of this, not merely to train instructor only, but also to develop the clinical educators who are competent and then professional, patient safety oriented, and also globally competitive. So this program, ladies and gentlemen, this program represents our commitment, our collaborating center commitment to strengthening the nursing capacity through high quality clinical education. Okay, next slide, please. Next slide, please. Okay, this is why clinical instructor matter. Why the clinical instructor very important? As we know that clinical instructor are much more than supervisor. They're not only a supervisor, they serve as a teachers. They also their role also as a coaches and then facilitators, evaluators. They also as role models and then patient safety advocates and professional leader. So many role of the clinical instructors in the hospital. So that's why we need to improve their capability, their competencies to deliver the education for the student in the hospital. So I think their influence extends far beyond the clinical placement period. So the clinical instructor directly shape the student competence, and then also clinical reasoning, professional behavior, and commitment to patient safety as well. Ladies and gentlemen, in many ways, the quality futures nurse, I think, depends significantly on quality of clinical instructors. If we want to improve the quality of nurse in Indonesia and in global, we also have to improve the quality of clinical instructor as well. So that's why strengthening the clinical instructor is one of the most strategic investment we can make in the nursing's workforce development. Next slide, please. Okay, ladies and gentlemen, this is the nursing clinical instructor curriculum overview that we have developed in our WHOCC. So this curriculum was intentionally designed to balance between theory and practice. And then the program consists of 30 training hours with 40% of theory and 60% of practical learning activities, including simulation and role play. So the curriculum focuses on 4 core learning outcomes that you can see in the slides. The first is professional attitude and ethics, and then the second one is clinical learning knowledge, and then the third is supervision and evaluation skill, and the last one is patient safety and preceptorship management. So, ladies and gentlemen, however, I would like to emphasize that the curriculum itself is not the final goal. The curriculum is a simple vehicle for achieving our broader objective. So, which is developing competent clinical educators capable of supporting high quality nursing education and also healthcare outcome. Next slide, please. Okay, ladies and gentlemen, so this is the key curriculum component that we have developed in our CC. So the curriculum includes 12 modules. We integrate the 12 module like mentorship and then patient safety and then clinical supervision, assessment, communication, cultural sensitivity, psychosocial support, and professional development. So this module were selected. Why? Because this 12 modules reflect the competencies required by modern clinical education. I think we add many components in this module, like professional development, also cultural sensitivity. Why we add the cultural sensitivity in this module, in this curriculum? Because we know that our nurse not only work in local area, in province or national, but also they can work in Southeast Asia and in global in the world. So that's why we need to integrate the cultural sensitivity and professional development and many other important aspects in our curriculum. Ladies and gentlemen, I think more importantly, this curriculum emphasizes not only knowledge acquisition, but also professional attitude and then reflective practice and leadership development as well. So this holistic approach help to ensure that the clinical instructor can effectively support the learner or the student while they're promoting patient safety and then ethical and also patient-centered care. Okay, next slide, please. So this is the innovative learning approach. In this curriculum, we also integrate the innovative learning approach. The learning, why we integrate this learning approach? We know that learning occurs through active participant rather than passive instruction. We need the participant or learner active in the learning. So that is why we use methods like a student-centered learning and then bedside teaching, clinical simulation, role play, peer teaching, guide reflection, and direct observation with feedback. So after we deliver the teaching method, we also create or develop the assessment method. So this assessment is also competency based. Not only the methodology competency based, but the assessment we develop based on competency based, because we need our alumni, our student, when they pass the examination, they have good competency. So the assessment is also competency based. That's why we utilize tools like knowledge testing and then mini checks, DOPS, and also portfolio assessment. So these approaches help to bridging the gap between classroom knowledge, teaching in classroom, and real world clinical practice in hospital. So I think they also encourage not only encourage knowledge, but also they encourage the critical thinking of the student and then reflective learning and continuous improvement among what not only instructor but also the learner or the student. Next slide, please. Okay, this is the partnership development model. As I mentioned before, that we have 5 pillars. The first pillar is nursing capacity development, and the other pillar is partnership development. I think research and development will be delivered by Prof. Eri. Let me focus on nursing capacity development and partnership development. The other one pillar is partnership development model. So partnership is one of the most important component of the NCI framework, Nursing Collaboration Initiative Framework. The WHO Collaborating Center, we serve as a hub to connecting multiple stakeholders. Our role is to make a connection, to connect many stakeholders. This include Ministry of Health and then health polytechnic as well. In Indonesia, we have 38 health polytechnic in Indonesia. Also, our role is to make a connection between health polytechnic not only health organic, but also teaching hospital and then healthcare facilities, professional organization, the WHO network, also universities, not only in Indonesia, but also in international and global and regional partners. So I think each stakeholder contributes unique expertise and resources as well. I think through this partnership, many component, many units, we can collaborate in many aspects. What aspect we can collaborate? We can collaborate in many aspects like curriculum development, and then training of trainers, faculty exchange, joint research, capacity building of the staff or nurse, and knowledge sharing between components. So, ladies and gentlemen, our experience demonstrate that strengthening nursing capacity, I think, cannot be achieved by a single institution working only. We need to collaborate each other. So it requires a collaborative ecosystem. So let me make ecosystem to develop this one, like educational institution and then health, healthcare service, government, and international partnership work together toward a common vision. Next slide, please. Okay, this is, ladies and gentlemen, I would like to share our current progress and early achievement in our WHO Collaborating Center. Since initiating this program, several important milestones have been achieved. We have developed the internal standard NCI curriculum, as I mentioned before, and also we have established the training framework, and then we build multi-stakeholder collaboration, and then create a capacity development platform, and also lead the foundation for future regional scaling. So I think this achievement represent the importance of our first step toward building a sustainable model for nursing workforce development. Ladies and gentlemen, looking ahead, our next priorities include like finalizing the training of trainer program, because before we conducted the nursing clinical instructor training, we have to conduct the POT training of trainer. So this is our looking ahead. Our next priorities is finalizing the curriculum for training of trainers program, because this trainer will deliver the training model for the nursing clinical instructor in the next time. And then we are going to expand our implementation nationally all around Indonesia. And then we are going to integrate digital learning approach. We also want to strengthening the regional collaboration, as I mentioned before, and developing new international partnership projects. Next slide, please. Okay, ladies and gentlemen, I think this is my last slide. This is key takeaway for this session. Allow me to conclude with 4 key messages of this topic. First, strengthening nursing capacity require high quality clinical education. Without prepare the high quality clinical education, we cannot strengthening the nurse capacity. So that's why we need to develop the high quality clinical education. Second, clinical instructors or CI play a critical role in preparing future readiness. So that's why in the first time we developed the curriculum of nursing clinical instructor in Indonesia. And also we are going to lead this curriculum not only in Indonesia, but also in global. And the third, NCI provide a practical and scalable framework for competency development. And fourth, or the last one, sustainable workforce transformation depend on strong partnership and collaboration. So that's why we need to collaborate each other. WCC as a hub to make a connection for this component. So we need to collaborate each other. Ladies and gentlemen, through education and then partnership and sustainability, I believe that nursing can make an even greater contribution to stronger health system and better health outcome. By strengthening nursing capacity and fostering strategy partnership, we can build a future ready nursing workforce. that can contribute to stronger health system and universal health coverage. Ladies and gentlemen, at the WHOCC, Health Polytechnic Ministry of Health Indonesia, we believe that strengthening nursing capacity is not only about training clinical instructors individual. It is about building sustainability system of education and in partnership and leadership that contribute to stronger health system and universal health coverage. Okay, I think that's all. That's all that I can deliver to you all. Thank you very much for your attention. Good afternoon. I give back to Bu Fida. Thank you. Thank you very much.
Good afternoon. Thank you very much, Prof. Lana. Thank you for the presentation. And as we highlighted from your presentation that to provide a high quality clinical education is essential to make a future ready nurse, and it is as a part of the health workforce transformation. And now moving forward to our next speaker, which is Ms. Hati Astri, the midwifery educator and midwifery leadership program facilitators from Poltekkes Kemenkes Jakarta 3. Ms. Astri has experience in midwifery education, reproductive and adolescent health, and institutional quality improvement and leadership development. Ms. Astri also plays an important role as a facilitator for a MLP program in Nepal. So I welcome Ms. Astri. The floor is yours, Ms.
Thank you, Fida. My sound is clear?
Yes, it's very clear.
Okay. Sorry, could you help me to share?
Yeah, I will help you to share. So.
Okay.
Okay, with my colleague, Mas Wirda, could you help us to share? Yes. Thank you.
Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, distinguished college representative from WHO, fellow WHOCC, and all participants. My name is Hati Astri. I am lecturer at the Poltekkes Kemenkes Jakarta 3, a midwifery program facilitator and the founder of Aku Sahabatmu, a community and digital movement focusing on maternal, adolescent, and reproductive health. Today, I would like to share not only how the midwifery leadership program was implemented at the WHO CC Poltekkes Kemenkes, but more importantly, how it's transformed leadership into the real impact for women, newborns, adolescent, family, and community. Because leadership is not measured by what happened in classroom. Leadership is measured by what change in people's lives. Next slide. Several years ago, I met a pregnant woman in a remote community. She didn't know the danger sign of pregnancy. She didn't know where to seek help, but what struck me on was not lack of information. It was the fact nobody had truly listened to her. The moment taught me an important lesson. Improving maternal and newborn health required more than clinical skills. It required leadership. Next slide. Through MLP, we learn that midwives are more than care provider. Midwife influence family, midwife influence community, midwife influence system. When we strengthen leadership, we strengthen maternal health, newborn health, adolescent health, and ultimately the health system itself. Next slide. One of the most valuable lessons from the midwifery leadership program is understanding that leadership is not an event, leadership is a journey. Many leadership programs are followed by the number of participant training or certificate awardee. However, MLP challenged us to think differently. MLP is not the destination, it is beginning. The program provides us with knowledge, tools, and framework, but the test of leadership begins after the training ends. It begins when we return to our community, when we face the real challenges, when we work with women, family, adolescent, policymaker, and health system. Through MLP, we learn that clinical competence remains essential, but it is no longer. To improve maternal, newborn, adolescent, and community health, midwife must also become innovator, educator, collaborator, and change makers. The MLP journey shifts us from simply providing care to creating the impact, from solving individual problems to influencing the system, from learning leadership to practicing leadership. Because leadership begins when learning is translated into action, and action creates change. Next slide. In Papua and North Maluku, we learned the most important lesson, leadership. When we first arrived, we thought the biggest challenges would be clinical. We expected to find the gaps in services, shortage of resources, or limitation in infrastructure. But what we discovered was something deeper. Many women were afraid to speak. Many families relied on misinformation. Harmful gender norms often limited women's ability to make decisions about their own health. And in some community, years of unmet expectation had created by profound lack of trust. These were not problems that could be solved by guidance alone. They could not be solved by technology alone. And they certainly could not be solved by simply telling people what to do. Through the Midwifery Leaders Program, we learned that leadership begins long before action. Leadership began with listening. Listening to story, listening to fear, listening to local wisdom, listening that community need rather than assuming we already know the answer. Only when the people feel heard do they begin trust, and only when trust is established can meaningful change happen. This experience transformed the way I think about leadership. MLP taught us that the first intervention is not speaking. The first intervention is listening, because trust is the foundation of every successful health program, and ultimately trust saves lives. Next. Strengthening maternal health through community ownership. Applying MLP tools such as stakeholder mapping, policy dialogue, and community engagement help us build trust before implementing program. We learned that sustainable maternal health improvement happen when community become owner of the solution, replacing stigma and with dialogue create trust, and trust save lives. Next. Protecting adolescent as a future mother. Through Aku Sahabatmu, we reach adolescent before they become mothers. Many young people receive reproductive health information from unreliable source. By creating safe space, school program, and digital education, we help adolescent make informed decision. Because today adolescents are tomorrow's mother. Investing in adolescent health is investing in future maternal health. Next. Translating a trust to the digital sphere. Today, young people may never visit a clinic, but they visit social media every day. MLP encourage us to expand leadership beyond physical space and into digital space. Through digital leadership, midwives become trust voice, providing evidence-based information where people are already seeking answer. Next. Leadership transcends borders. One of most meaningful experience was facilitating MLP in Nepal. Despite difference in geography, language, and resource, we discovered a shared commitment: protecting women, protecting newborn, protecting community. Leadership has no borders. Next. How a context shaped the leadership response. Nepal taught me resilience. Papua taught me trust. North Maluku taught me service. Aku Sahabatmu taught me hope. Different challenges require different approach, but leadership remains the same, creating positive change wherever we are. Next. Leadership grow within ecosystem. The success of MLP is not the result of one individual. It's the result of a leadership ecosystem. WHO Collaborating Center Poltekkes Kemenkes provide education, research, community engagement, and international collaboration. Leadership does not grow in isolation. Leadership grow within ecosystem. Next. Advancing to a global leadership movement, MLP 2.0, looking ahead, we believe MLP must evolve from a training program into a leadership ecosystem through leadership incubation, digital leadership, community project, regional network, and MOOC. We can scale leadership beyond individual and build regional capacity. The future of midwifery requires not only clinical excellence, but leadership excellence. Next. Ladies and gentlemen, in Nepal, I saw leadership in resilience. In Papua, I saw leadership in trust. In North Maluku, I saw leadership in service. Through Aku Sahabatmu, I saw leadership in hope. And through MLP, I learned that leadership is not about position. Leadership is about creating positive change wherever we are. Every woman deserves dignity. Every newborn deserves a healthy start. Every adolescent deserves reliable information. Every community deserves compassionate leadership. And every country deserves midwife who lead. MLP is not program. MLP is a movement. Thank you. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Bu Heti. That was very beautiful. Your presentation really reminds us that improving maternal, newborn, adolescents, and community health requires more than clinical competence. And the quote was extremely beautiful, that the leadership starts with listening, which shows it requires midwives who listen, understand community barriers, lead change, and translate leadership into practical innovation and community impact. Well, thank you so much, Miss Astri.
Thank you, Fida.
Yeah. Okay, now after the second session, I think we can move to the third and last topic for our today's webinar. And the third topic will be about the research, innovation, and international collaboration. For our first speaker will be Dr. Catherine Siongcho from the University of Philippines. Dr. Catherine is an assistant professor at the University of the Philippine Manila College of Nursing, and her academic and research work includes primary healthcare, aging, long-term care, health inequalities, and interprofessional collaboration. So for Dr. Catherine, the floor is yours.
Thank you very much. Yes. Oh, will you be sharing my slides from your end, or I can do it? Or
We can help you
okay,
share
great.
the
Thank you.
slides.
Thank
Yes.
you.
Okay.
Yeah, I understand that I have a good 15 minutes to deliver my topic. So anyway, thank you for the very humble introduction. Let me introduce myself. I'm Catherine, or they call me Kate. I'm Kate Shongko from the Philippines. I'm a faculty in the College of Nursing, University of the Philippines, Manila. So good day to all, to the entire audience. And thank you to WHO CC Poltekkes Kemenkes for giving us this opportunity to be able to share the best practices that we have in research when it comes to primary healthcare nursing. So here I'm going to deliver advancing primary healthcare nursing through research and international collaboration. And I just like, for the information of everyone, initially in 1989, we've been designated as the World Health WHO Collaborating Center for Nursing Development in Primary Healthcare. But in 2004, we were redesignated as a Collaborating Center for Leadership in Nursing Development. So mainly, when we're going to talk about role, it's to strategically support WHO to develop and strengthen institutional capacity of nurses in countries and regions as well. Next slide, please. Now, for to start with the background, yes, it's important. But I was sure when I saw the program that the previous topics will be able to cover already the importance of primary health care, nursing. So I would like to start now because that was already laid as a solid foundation before my talk. I would like now to focus on what are the challenges that pushed us as a WHO collaborating center in leadership in nursing development to focus on workforce research on HRH or workforce development. So, of course, number one, we all know that future-ready nurses and midwives are critical for resilient health systems. And needless to say, nurses and midwives represent nearly 50% of the global health workforce. And when we talk primary healthcare, we are the frontliners. But of course, there are challenges such as climate-related health emergencies. And this is one of the things that we saw, the findings that we saw in our researches that I can show you later on. That's important in determining the needs or the competencies of nurses and midwives in certain localities here in the Philippines. And I'm sure this is also a picture that is common to other countries as well. Of course, there is the never-ending migration and retention issues and the unequal distribution of health workforce. Now, with all of this, we know that primary healthcare is a whole of society approach of health that focus on when we talk about UHC, you know, the health promotion, disease prevention. Of course, we also have the community engagement, person-centered care, and the multi-sectoral action. Next slide, please. Now, like what I mentioned a while ago, we were redesignated from 2024 to 2028 as WHO Collaborating Center in Leadership in Nursing Development. So in the Philippines, we remain the only nursing institution with this kind of recognition. And when we talk about strategic areas, we focus mainly, of course, nursing leadership is one. Number two is workforce development. So we have several programs when we talk about capacity building of our nurses, when regardless if they are in practice, if they are in the academe, or if they are in other sectors, of course, related to healthcare. We have primary healthcare is another one, considering the institutionalization, not institutionalization, but the universal healthcare law was passed into a law in 2019. So most researchers now, since that time, actually even before the time, focuses on how to strengthen the health systems of this country. And of course, one more important thing is the evidence-based practice. Now, next slide will show you our global partnerships. And the reason I wanted to show you this is I think I have to update this because we have maybe around 2 to 3 additional more here in our global partnerships, is because this is how we disseminate, our programs, and how we capitalize on the opportunity, to become a WHOCC and to improve the capacity of nurse leaders in the region and globally as well. Next slide, please. Now, in the next slides, I'll be showing you 5 manuscripts. I'm not going to discuss one by one, but later on, what I want to pick on is more of providing you with themes on how it's important, how these researches shaped how we improved on our contribution as nurses to the primary healthcare system here in the Philippines. So number one, we have, of course, back in 2020, we had the pandemic. So we would like to look into what is the pandemic impact, the support received by our nurses, and the policies for healthcare health worker retention. It was an environmental scan, and we'd like to see, here we explored, on what are relevant policies for better workplace conditions. Next slide. Can you just click next? The next one shows you, yes, if sorry, excuse me. Now, this is another research on staffing and workload in primary care facilities of selected, we call them GIDA here in the Philippines. It stands for Geographically Isolated and Disadvantaged Communities in the Philippines. So this research paper actually is part of a bigger project wherein we employed the WISN methodology. If I know most of you are familiar with the workload indicators for staffing needs from the WHO. So we looked into the cadres, midwives, nurses, and physicians. The reason why we only looked into the three cadres is because the first study that we did before, we found out that there is no clear delineation between the roles and responsibilities, the scope of practice, the roles and responsibilities of the three cadres in village. We call it barangay here in the Philippines, in the villages here in the Philippines. So we would like to look further into that. Next slide, please. Another is we have several leadership development courses or programs. So first is the leadership development program for public health nurses. We would like here, this is later on you'll see that implementation science principles were put into place. Then the next slide shows you, I think it's another leadership development course program. This is in relation to the public health nurses leadership development program. So here we would like to look into the perceived competencies and training needs of public health nurse in the Philippines. And this was a basis actually in developing the nurse lead or the nurse leaders program, a leadership course on advanced practice nursing in public health. Now, in the Philippines, just a briefer, we still don't have advanced primary nursing in the scope of practice, but we have been lobbying for it for many years now, and we are still continuing to lobby for it. So, of course, we cannot wait in the sidelines. We have to continue to do the work, even though it's not yet within our scope of practice. So when it's legalized already and it already has a legal framework, we have already instituted initiatives like, for example, MSN degree program. How are you going to the number of clinical hours that's needed? How are you going to push through? Do you need a clinical nurse specialist or advanced practice nurse or those several advanced practice scopes of practices. So that's what we're doing right now. Another is the next slide is the fifth one, last but definitely not the least, the needs assessment for the development of a leadership course for midwives, a qualitative study. So this is a grant that we got from the Department of Health here in the Philippines, and we have a leadership development course for nurses, then we also have for midwives, and this is more of a needs assessment for it. So if you can move to the next slide, I'd like to show you 5 to 6 best practices of our institution. So first, of course, the leadership development for public health nurses. We developed here a competency-based leadership anchored on health system strengthening. So it's targeted. Here we integrated workplace based capstone projects. So we asked the participants to develop capstone projects that will address the local needs in their community. It's focused on service delivery, it's focused on governance. Then when it started, we had 183. But right now, I think there's several, that's batch 1. Now we are in batch 6 or 7 already, and we focus not only on nurses in practice, we also focus on public health, nurse educators as well. So participants demonstrated increased leadership capacity, policy advocacy, skills, and health systems thinking. So with all of this, it's important to know its international relevance. And of course, what's the impact to primary healthcare nursing, right? So international relevance, in a point of view of international relevance, it's a scalable model for developing public healthcare nurses in low and middle income countries. Next slide. Okay. So this is just a photo of it. So this is one batch, and we already have 7 batches already. Next slide, please. The second best practice that I would like to share with you is the competency assessment and workforce capacity building. So here again, public health nurses as well. When we say public health nurses, these are nurses in the primary care healthcare units, and we looked into identifying competency strengths and gaps across public health domains. So basically, what we saw here, the strongest competencies that they saw amongst themselves were in communication, community practice, and analytical skills. Then from here, from the results, they were able to the college was able to develop the Nurse Lead Project, which is a leadership course for advanced practice in public health nursing. Then it demonstrated how workforce research can guide national nursing leadership development strategies. So this is what we call evidence-based. So it's an evidence-based workforce development. We looked into what is needed before actually developing the course. Then it's targeted again in competency strengthening, and of course with the UHC law, we are preparing nurses to be better equipped for the implementation of universal health care or universal health coverage. Next slide. The next slide will shows you midwifery leadership development for universal healthcare. So this is the qualitative study I have mentioned a while ago, and here in the Philippines, of course, when we talk about midwives, we know that they're critical providers of maternal and newborn services. But when we talk to midwives here, they are really empowered. They tell us that they would like to go beyond the usual health services that they provide. They would like to be able to lead because they can see from a vantage point what are also the needs of the people in their community, the population in their community. So we conducted a needs assessment among midwives, and not only from the primary healthcare units. We expanded into the academe, professional organizations, clinical practice, so we could get a better grasp of what are the competency gaps. And what we saw were identified critical needs: what leadership, management, research is another thing. In the advent of technology, health informatics, they'd like to know more about it because for them, that's what's important for them to be able to lead in the community. And of course, this project supports WHO priorities on strengthening the midwifery workforce to achieve the Sustainable Development Goals and the UHC. Next slide. Sorry, excuse me. Oh, this is research to practice translation, evidence-based capacity building. Now, we had one research wherein this is the leadership development course for public health nurses, and one of the requirements for that is they develop a capstone project. Now, what we would want to see here is how they applied it into their workplace. So that's what we were calling that we were able to focus on implementation science guidelines here in this research. So what we saw here is workplace application plans, mentored implementation. There's leadership coaching as well, and of course, monitoring and evaluation is important. And here it provided a model. So that's my to stop. Provides a model for translating research evidence into primary healthcare service delivery improvements. Next slide, please. The fifth one shows us international collaboration for nursing leadership and health system strengthening. So it's not, I'll try to finish in a minute, to also expand beyond national borders is important as well. And here, we looked into global health challenges requiring cross-country learning. So even though there's differences in our settings in the health systems, we can still learn from each other. Needs assessment research is important, workforce competency studies as well, evidence-based workforce development, health systems analysis as well, and continuous evaluation. Next slide is the last one is innovation in task sharing to strengthen primary healthcare. I'm sure everyone has heard about skill mix. the WISN methodology. So here, we looked into the entirety of the healthcare provider network. We looked into the three cadres, the midwife, the nurses, and the physicians. How are they task sharing, task shifting? We found out that in far-flung areas, in rural areas, those that are climate prone, disaster prone rather, those that are geographically isolated and disadvantaged areas, they don't even have physicians. They don't. Some have midwives only. Some have nurses only, and the task shifting is glaring. So even though, sometimes it's difficult to delineate that this is not my scope of practice, but they have to, as health workers, respond to the needs of the population. So I think we have to protect her healthcare workers as well, in the same manner that we have to uphold the needs, the health needs of the population. So mainly the question here is, how can evidence-based workforce planning improve the access to primary healthcare services in underserved communities? So next is this is the model that we developed based on the research on skill mix. The next slide, please. So here, we saw here that if we're going to look into skill mix, task shifting, task sharing, it's important for community-specific analysis first, because that will give you evidence on developing what competencies is needed. But of course, we need also going down the health workforce planning vis-a-vis inter-organizational collaboration. And when we say that, we're looking into what do you call this? Integrating the public and the private health sector as well, and going down to the production, recruitment, retention, systems improvement as system improvement. And here, HRH governance basically deals with strategies to improve the health workforce. Next slide, please. In summary, so the research studies, of course, it always tells us that we need adequate staffing, equitable workforce distribution, and we're talking community-specific analysis before, improving on the competencies of the health workforce. Evidence-based planning is important, team-based care, and capacity building of nurses and midwives. Key messages, I just picked 4. Of course, number 1, research drives better primary health care. Leadership matters as well. So to be in clinical practice is one, but of course, it's also career progression for the midwives and nurses. Capacity building must be evidence-based, and international collaboration accelerates impact. So it's important for us in the college. It's important to capitalize on equipping nurse leaders with the concepts that are basically actually related to global health, and developing competencies in leadership is one. Policy engagement is another, and advocacy is very important for us. Number 2, we ensure that learning strategies by having participants, from various contexts and experiences, various health institutions and practices. And the third is they reflected on the strengths and limitations of course, several learning strategies or learning platforms. And with that, so if you want some updates from our from WHO Collaborating Center for Leadership and Nursing Development, so you can we have in Facebook, you can just look for it, University of the Philippines Manila College of Nursing. So we update it every so often, if not always, and here are my references. Thank you for your attention.
Thank you so much, Kat, for your beautiful presentation. And let me wrap up. And before that, happy Independence Day for Philippines. We highly
Yes,
appreciate
thank
your
you. Oh
support.
yeah, I was planning to say it, but yes, it's an Independence Day here and it's a holiday. So yeah, thank you.
Yes, thank you so much for your support by becoming our speaker for
Thank you.
this
Yes.
webinar.
Thank you for the opportunity.
Yes. And yeah, from your presentation, it's really demonstrate how research and innovation can strengthen evidence-based nursing practice in primary healthcare. It has also highlighted the value of regional academic partnership in developing research capacity, sharing methods and evidence, and absolutely to preparing the nurses to respond
to increasingly complex community health needs. And moving forward, our next speaker is Professor Ferry Effendi. Professor Ferry Effendi is a professor of community health nursing at Universitas Airlangga. He has extensive experience in health workforce research, community health, nurse migration, scientific publication, research networking, and international academic collaboration. Professor Ferry's presentation has been pre-recorded. However, Prof. Ferry will join us in the Q&A session. May I invite our technical colleague to play the pre-recorded presentation video from Prof. Ferry. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone, from wherever you are joining us today. It is a great honor to share this virtual stage with esteemed colleagues from across the world and also Indonesia, and to be part of this meaningful event. And firstly, distinguished WHO Collaborating Center, Poltekkes Indonesia, Dirjen SDMK, and also WHO of Indonesia. It is an honor to see you all here, and also all of the audience and guests across Indonesia. Yeah. And yeah, firstly, let me introduce myself. My name is Ferry. I'm now teaching at the Faculty of Nursing, Universitas Airlangga Indonesia, and currently serve as the head of the Institute of Journal Development, Publication, and Intellectual Property Right at Universitas Airlangga Surabaya. And also I'm currently adjunct professor in 2 countries, yeah, Australia and Taiwan, especially in the School of Nursing. And yeah, if we look at the current presentation, yeah, actually our presentation inspired by the recent document, yeah, launched by WHO in 2026, yeah, with the title Global Research Agenda on Knowledge Translation and Evidence Informed Policy Making. And yeah, let us face the reality that we are working in. Yeah, by 2030, yeah, the world will face a shortage of almost 10 million, yeah, of health workforce, yeah, and the vast majority of whom are nurses and midwives. Yeah, and according to the data, primary healthcare, yeah, delivers 75% of all health intervention globally, yet it remains chronically under-resourced and critically under-researched. And to this date, yeah, nurses and midwives constitute 59% of the global health workforce, but their contribution to health research output is nowhere near that proportion. Yeah. And yeah, this is the science gap. Yeah, the evidence base for community health practice lags far behind clinical hospital medicine, and this is not a theoretical gap, it is a gap with life or death consequences. And as one of my mentors said that, yeah, no health without a health workforce, yeah, no health workforce without science. Yeah, that is why we are here. And yeah, let me make the scale concrete. Yeah, 400 million people, nearly half a billion, yeah, still lack access to essential health services according to WHO 2023, and 1.8 billion people live in rural or remote areas where nurses and midwives are often the only health professional available. This is according to the World Bank study in 2023. And 45% of preventable death occurs due to gaps in primary healthcare. Yeah, and again, according to WHO 2022. 137 countries, yeah, face critical nursing shortages until to date. Yeah, and as we can see that community health nursing and midwifery, yeah, are the backbone of primary healthcare, yet they remain the most under-researched, underfunded, and also underrepresented discipline in global health science. So the policy architecture is already in place. Yeah, we have no excuse not to act. Yeah, the WHO global strategy on human resources for health, 2016 to 2030, mandates evidence-based workforce planning. Also, I do believe that most of you already understand the state of the world nursing policy guideline, explicitly calls for expanded research capacity and publication output by nurses. And again, the WHO, the WPRO Nursing and Midwifery Framework emphasizes translating research into community service. And as we can see that the SDGs 3.8, universal health coverage, requires a robust primary healthcare evidence ecosystem with 3 pillars, workforce science, fit health system research, with drive global health equity. Since science is the engine that move all the 3, we are not doing this because it is fashionable, but we are doing this because the world health system depend on it. Now let us be specific about where the gaps are and where the opportunities lie. 5 critical voids in community health science, starting from implementation science, digital health integration, midwifery-led care models, mental health in public health center, or primary health care center, and also health equity assessment. And then but for every gap, there is a collaboration opportunity. We can conduct joint research consortia, and then we can have a collaborative publication. We can have a capacity building, and also we can initiate data sharing networks. To organize all of this, I want to introduce a framework we have developed and used in practice. Actually, this is taken from the policy document, the WHO Human Resources for Health Strategy 2030. Maybe some of you already aware about this framework. We call it the GCARE model, Global Community Academic Research Excellence. And at its center, it is the pursuit of global excellence. Around it, 5 interconnected components, from governance and ethics, and then COPE standards, IRP protocols, and open access commitment, and then community engagement, especially participatory research that put community at the center, not the periphery. And also academic network. We can include the issues of co-authorship and research exchange program, and capacity building, starting from the ECR training, mentorship, and also skill development. And then the last things is evidence translation. Moving finding from journals to policy practice and WHO submission. So this model is grounded in WHO HRS strategy 2030, and COPE research ethic. Let me give you 5 concrete frontiers where collaboration can begin immediately. Frontier 1, digital health and mobile health, AI assisted community screening, remote maternal monitoring, and also teleconsultation evidence. The second frontier is talking about health workforce resilience. I think this is really important to see how is the issues of nurse retention and migration, how is the push and pull factors between countries in certain regional, and also how is the rural deployment models that really effective in retaining and also the workforce, especially in rural and remote areas, and also burnout and well-being science. And then the third frontier is universal health coverage. It's public health, primary healthcare access equity metrics, community health insurance, and also outreach effectiveness. Frontier 4, midwifery-led continuum care. It's consisting about respectful maternity care, postnatal community model, and also sexual and reproductive health integration. And then the last frontier, mental health in community. It consisting community-based intervention, task shifting evidence, and also stigma reduction models. And one thing to collaborate is actually very visible. And actually doing it require a clear architecture. Step one, we can make a connection with the potential partner, like through the OU, through exchange agreement and another joint academic and research activities. And then step two is co-creation, joint research proposal, grant application, and shared study design. This is where ideas become plans. And then the third is co-publish, multi-site studies, like joint papers, conference, keynote. This is where plan become evidence. And then the step four is translate, policy brief, WHO submission, practice guideline, and etc. So I want to make the case for Indonesia as a strategic partner. As we can see that we are having a huge population, and also Indonesia is vastly different geographic. We are consisting of 34 provinces, and also we have more than 700 plus nursing study program. And of course, the partnership opportunities is really obvious. Not only in the regional setting, but also across the world. Apology, this slide is still in Bahasa Indonesia, but this is a story about our research. When back to 2014, when we received a grant from Sumitomo Foundation, and then we did a research about Indonesian nurses migration, especially in Japan, through the EPA project, Economic Partnership Agreement project between Indonesia and Japan. And after that research, that project completed and published, 10 years later, it is being a reference, especially from the WHO and other global entities. So that's with another research that we conducted, throughout our initiative. It's been cited and referenced from some global entities, across the world. And I want to close by returning to the global framework, the WHO Global Research Agenda on Knowledge Translation and Evidence-Informed Policy Making, was developed through a rigorous consultative process between 2023 and also 2025. And actually, this research agenda dedicated for researchers, funders, policymakers, practitioners, and also the civil society. And the agenda has 4 goals. First is define key priorities, and then move to raise awareness, drive strategic investment, and also strengthen collaboration, especially in the North and also global South countries. And there are 19 priority research areas, within the 3 core domains. And domain 1 actually intervention. It has 8 priority areas focused on how knowledge translation is implemented. And then domain 2 focus on the barriers, facilitators, and opportunities. 6 priority area, including diversity, equity, inclusion, and life experience. And then domain 3 from method, standard, theories, and framework. And all these 3 domains are interconnected, and all 3 are directly relevant to the work we do in community health. So this is my last slide. I will leave you with 3 convictions. Science is the foundation of health equity, and community health nursing and midwifery must lead it. And then international collaboration multiplies impact. No single institution can solve what the world needs alone. And then last but not least, the opportunity is now join us in building the evidence base that communities deserve. Yeah. So yeah, the future of global health belong to those who researched together. Yeah. So thank you so much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Well, thank you very much for the pre-recorded presentation from Prof. Ferry. Prof. Ferry actually has joined the meeting in the Zoom. Yeah, thank you, Prof. And the presentation really has underlined that there can be no strong health workforce without strong science. And the presentation also shows that practical opportunities for collaboration through joint research consortia, publication, capacity building, data sharing, and ethical government, community engagement, and evidence transition into policy and practice. Thank you, Prof. And now, ladies and gentlemen, we will move to our next section, which is Q&A. We have heard a consistent storyline, a global and regional strategies. It must be translated into country action, education and leadership. Programs must result in better practice and services. And now, please, we welcome all the speakers, and we will begin the interactive discussion. For any participant that has a question, please raise your hand. Thank you. Is there any question for our speakers? And any question that is directed to Dr. Catherine will be sent through an email. So please feel free to type the question as well in the chat box. Okay, we have one person raising her from Fajar. Okay, please, Pak Fajar, can you? Yeah.
Thank you very much for the opportunity. Ibu Vida, if I'm not mistaken, my apology if I spell your name incorrectly. Actually, this is a basic questions that I would like to ask for probably Professor Ferry. Things that you have presented for us, actually, it's like, if I can say, it's like an advanced research. What about like me, maybe, if I'm the beginner for the research, maybe in this context that global partnership in joint research, actually, what can we do as a beginner as a researcher in Poltekkes Kemenkes can do that will also elaborate the global research that you have mentioned in your presentation. That's the questions, Ibu Vida. Thank you for the opportunity once again.
Thank you. Thank you so much, Pak Fajar. So for Prof. Ferry, the question from Pak Fajar is, what can we do as the beginner level researchers? How do we elaborate our research to the global research? Thank you, Prof. Ferry.
Yeah, thank you, Pak Fajar. Yeah, I think that's a great question. Yeah, to my experience, yeah, at the first time for the beginner, yeah, I would like to find a collaborator, yeah, or a mentor, yeah. So collaborator and a mentor is an essential, yeah, in a pathways of our researcher, especially as a young researcher. Yeah, we learn from them. Yeah, we learn the best practices, and also we learn how to build the ecosystem. Yeah, especially in the ecosystem of the doing research. Yeah, that can be transformed into policy action.
I'm sorry, Prof. I think there is a connection problem. Yes, it seems like there is a connection problem from Prof. Heri.
Could be the internet
Or
issue.
Yes, Pak Fajar, please.
I still can catch up with Prof. Ferry. Maybe he has an internet issue.
Okay. Yes. Yeah, I think so. And okay, for the answer of the question, like how do we do as a beginner researcher to leverage our research to global research? Well, it's to have a mentor for it. And I hope Prof. Ferry is joining us soon. Yes, Prof. Ferry is already joining us. Please, Prof. Ferry.
yeah, thank you so much. Yeah, sorry, I think I have a what is technical difficulty, yeah, because I'm on my way to remote areas especially, yeah. So to my experience, yeah, find a mentor or collaborator, yeah, that's really essential for the young researcher, yeah, to find the best practice and also to find yeah, committed and high quality collaborators, yeah. That's the first one. And then the second, I think for us, we can observe what is going on in our society or our environment. Yeah, like nowadays, yeah, we have seen that a lot of what is it issues about the impact of the war, yeah, in the Middle East, yeah, especially to our daily society. And then the second is we can see that the government also actually needs suggestion and recommendation, yeah, to improve the delivery of MPK, yeah, makan bergizi gratis, yeah. And then the third, yeah, we can also trying to help to improve the issues of the free health check, ya, or cek kesehatan gratis, pemeriksaan kesehatan gratis, ya. I think that's an easiest way, ya, to conduct research and no need like high or advanced level of research like rocket science, but you can see and you can look at the family, the society, the aggregate in your daily life. Yeah, what are their problem and what are their needs? Yeah, what is your expertise that's matching? Yeah, matching the problem and how can we do to bridge the problem and the solution? Yeah, so I think that's. What I learned so far, yeah. So for example, in my study, yeah, mostly I learned a lot how is the preparation of Indonesian nursing graduate, yeah, to work overseas. Yeah, they have to joining the additional training, especially in the language competencies. Yeah, they also have to learn the cultural aspect of the destination countries and many things to do. Yeah, but actually, what we can do is preparing from the first semester. Yeah, integrated into their curriculum. Yeah, what are the language competency needed and what are the what is it additional skill, yeah, that needed by the candidates, yeah, for working overseas. Yeah, I think that's really relevant, yeah. That's still having a highly relevancy, yeah, with the problem. Yeah, so I would suggest, yeah, that for the young researchers, yeah, you can find to look for the collaborators, yeah, maybe through the network of WCC of Poltekkes Kemenkes Indonesia, yeah. There are a lot of researchers here, and also you can find the partner, yeah, from the WHOCC, and also you can find the partners that coming from the university and also coming from another stakeholders. Yeah. So I think the most important thing is you must keep open mind. Yeah, because yeah, everything has changing. Yeah, like nowadays we face the AI disruption. Yeah, in our society, and I do believe that a lot of opportunities for the open-minded researchers. Yeah. Thank you, Mbak Vida.
Thank you so much, Prof. Ferry, and for Mas Fajar. So the point is to find a mentor or collaborator, to find committed high collaborator through the WHOCC, and how to find the supporting environment and aligning the research to current trending issue. It's about matching the problem to the solution. Is there any other question, Pak Fajar?
Thank you very much, Ibu Vida and Prof. Ferry. That quite answer my questions very much. Thank you.
Okay, thank you. For the next question, anyone? Please feel free to raise a hand or write in the chat. Okay, if there is no question yet from the participants, I would like to ask a question to Bu Hati Astri. Bu Hati Astri, the question is, what support do the MLP graduates need after training so that their leadership projects create sustained change in institutions and communities? Bu Astri, please.
Okay, thank you, Vida, for your question. Thank you for this important question. Based on our experience, leadership development does not end when the training ends. In fact, the real leadership journey begins after participants return to their institution and community. To create the sustained change, MLP graduates need to support in at the least 4 key areas. First, mentoring and coaching. Many graduates have innovative idea, but they need ongoing guidance from experienced leader to navigate challenge and sustain momentum. Second is institutional support. Leadership projects are more likely to success when organizations provide enabling environment, including management commitment, opportunity to lead, and integration of project into existing system and priority. Third, peer network collaboration. MLP alumni networks can serve as a platform for sharing experience, learning from one another, and developing a joint initiative across region and country. For opportunities for continuous learning and innovation, including research, digital leadership, advocacy skill, and policy engagement. So that leadership continue to evolve alongside emerging health challenging. Therefore, the future of MLP is not only about training leaders, but also about building a leadership ecosystem that enable midwife to creating lasting impact for women, newborns, adolescent families, and community. Thank you.
Well, thank you so much for the answer, Bu Hati. That's really answering my question. So we have reached the end of our webinar today. If there is no other question, I would like to go to the closing of this webinar. So, ladies and gentlemen, before we close this webinar, I would like to report to our Director for Health Workforce Provision, which is Bu Anna, that today's webinars, it is reported that there is approximately 180 people joining the webinar through Zoom meeting, and now it's 160, and there's like 159 people who registered on the on our Google on our Google list, and then there's like 1,020 people who is joining us through the learning management system. So before we close it, ladies and gentlemen, let us welcome the Director for Health Workforce Provision to deliver the closing remarks. To Bu Anna Kurniati, the floor is yours, Ibu.
Yeah, thank you, Vida. First of all, I also would like to congratulate all of you, the organizer, as well as the distinguished speakers today. Even though I do not join the entire webinar, but I also joined some part of the webinar, and I really appreciate the time and also the expertise that's shared by our speakers. And as today is the end of our today's session, but I think based on some of the questions and answers that we already heard during the interactive session, I think that we would not stop to today's webinar only. I think we also need to create a better environment that enable especially young researchers. And we have even in Poltekkes only, we have more than 5,000 teachers. Yeah, and we also across Indonesia we also have thousands study programs, whether they are in public universities or private universities. So I think those are our partners to develop further collaboration to promote strengthening the nursing and midwifery programs. So currently we have a leadership program, but also we know that to further promote the nursing and midwifery for the future health challenges, I think we also need to put some of our effort and also our resources to do a better impactful research. So today we already heard from our speakers as well as from the questions from the participants with a diverse perspectives from the WHO, not only from the WPRO, but also from the headquarters from Indonesia, and also from other colleagues from Poltekkes as well, and also from Universitas Airlangga, Pak Ferry. So I think we can gain some insight on how we can work together in the future to collaborate, doing more impactful research. We are also grateful that currently in our Poltekkes, we receive funding from the UNFPA, especially from the Global Fund, from the Global Fund to do the operational research for HIV, for malaria, and for tuberculosis. So I think it will also provide us some experiences that would be a valuable lesson on how to build a future cooperation and collaboration with other research partners as well as other academicians on how to multi settings as well as with other international partners. And we also learned today that some programs, even though just recently introduced by the Poltekkes WHO Collaborating Center, because we just started maybe in only 1 year, but I think there are some progress that we already made. And through this kind of webinars, we would like to share our progress and also seek some inputs, feedbacks on how we do better for our WHO Collaborating Center. So I do hope that this webinar will not the only webinar that would be conducted by our WHO CC, but will also welcome other opportunities to have other kind of knowledge sharing, not only through webinar, but maybe through other workshop and other working together. We will support nurses and midwives so that we can together build a stronger, more resilient, and more people-centered. All our speakers from the Collegiums of Nursing and Collegium of Midwifery, facilitators, organizing committee, and also our create within Indonesia, but across the globe. Thank you very much. Wassalamualaikum. Until we meet in the next webinar. Thank you.
Thank you, Bu Ana. Thank you so much.
Thank you.
Yes. And yeah, so ladies and gentlemen, now we have heard the closing remarks from Bu Ana. So that marks the end of our webinar. Thank you for attending this webinar. Good evening, everyone.
Goodbye, everyone.
Goodbye. Thank you, Ibu Ana. Very much.
Thank you, Bu Ana.
Bye.
Thank you, guys. God bless.